My name is Kelly Mullen and this is Julie Edwards, and we are in a group presentation for a case study. Our patient is a pediatric patient who has been diagnosed with an acute ischemic stroke, and we are going to present stage 3 of the case study.
Bart improved in the ICU with the TPA administration and then was moved to the medical floor for observation. Once on the medical floor, he was started on a medical regimen for stroke prevention, AFib, and high blood pressure. He was also started on a cardiac diet, and he had no signs and symptoms or complications from the TPA administration. He had 0 residual from the stroke and an NIH stroke scale of 0. He was assessed by all consulting physicians and cleared for discharge with the diagnosis of acute ischemic stroke with a secondary diagnosis of atrial fibrillation.
Okay, patients, he was educated on having an acute ischemic stroke. He was educated on the prevention of a stroke and also atrial fib, as well as diet and exercise and diabetes. The patient was made follow-up appointments with a cardiologist and also a neurologist. He was given prescriptions for medications that included Eliquis and an 81 milligram aspirin and metoprolol for his blood pressure. Education on importance of the medication compliance was given, as well as the signs and symptoms to be aware of while taking these medications. He was given instructions to return to the emergency department should any of his symptoms come back or should he worsen. Then we went to stage 3, the questions, critical thinking for my nursing students. Why do you discharge a patient on antiplatelet therapy after a stroke and a diagnosis of atrial fibrillation? So think about that one, and I'll have the answer in a minute. Our second question is, how did the patient's pre-existing condition of pre-hypertension contribute to his acute ischemic stroke? For question number 1, patients with atrial fib and ischemic stroke, the guidelines recommend for them to be discharged and placed on an oral anticoagulation for the secondary prevention of the ischemic stroke and clot prevention. And also with atrial fib, that's also a diagnosis to be on an anticoagulant to not prevent clots. For question number 2, the uncontrolled high blood pressure can lead to stroke by damaging and weakening the heart's blood vessels. That causes them to narrow, they can rupture, and they can leak. High blood pressure can also cause blood clots to form in the arteries leading to the brain, which can cause a blockage, cause the blood flow to back up, and that will lead to a stroke, which in this patient's case, that is exactly what happened. And that is our presentation.